Hello and welcome to Health Professional Radio. My name is Patrick Reyes, and on today's show we have Dr. Saxon Smith. Now, he's an Australian-trained dermatologist and holds a fellowship with the Australasian College of Dermatologists. He graduated medicine from the University of Otago in New Zealand. He has a master's degree in health law from the University of Sydney and is a graduate of the Australian Institute of Company Directors. He is also a consultant dermatologist in private practice in Gosford, a visiting medical officer at Royal North Shore Hospital, and a clinical associate professor at the University of Sydney. He's here today to talk about eczema and its prevalence, especially amongst young kids. Welcome to the show, Dr. Saxon.
Thank you for having me on.
Now, can you tell us how significant or prevalent eczema is in Australia?
Well, what we know is up to about 20 to 40% of children in Australia will get eczema in one way, shape or form. And that prevalence has actually doubled in the last 20 years, so it's becoming more common.
I see. And what are the current guidelines for managing eczema?
Well, what we know with eczema is that it's a complex sort of condition which is both a genetic predisposition but also how the world interacts with that genetics. So, whether you have allergies, whether you're in a sort of a dry environment. So it's actually really important to try and have a treatment plan that targets all of these aspects where appropriate. So in order to sort of combat the genetic sort of predisposition towards eczema, it really relates to making sure the skin is really well moisturized by using sort of soap-free washes to avoid the detergent effect of normal soaps, a regular moisturizer on a daily basis, if not a twice-daily basis during winter in particular as well. And then also having sort of short lukewarm showers or having a bath oil in the bath for younger children. So that makes the skin to be the most moisturized and most resilient that it can be. Mm-hmm. But there will be times when you'll have the eczema flare up and you'll have red, itchy areas, and that's an inflammation process that needs an anti-inflammatory cream to be put onto that. And one of the main anti-inflammatory creams we use are topical corticosteroids, and that will help settle down that component. But you need to maintain that moisturizer and soap-free wash sort of background all the time. But we also know that children with eczema are more predisposed to infection as well, and this relates to the fact that there are these little proteins on the skin which act as a natural defense to the bacteria that cover us on a day-to-day basis. And in children and adults with eczema, they have fewer of these little proteins, so they're more likely to have issues with infection. Now, that infection might not make you unwell, but it will certainly get into the eczema in the skin and make it a bit more difficult to treat. So there are times when you might need to have antibiotics or other antibacterial preparations to control that as well.
Oh, I see. And if there are, can you tell us about the adverse effects of using topical corticosteroids?
What we know about topical corticosteroids, they are a key component in managing eczema. They're used as that anti-inflammatory to settle down that active eczema. And what we know with topical corticosteroids is they've been around a very long time. But there has been a lot of misinformation about the safety around topical corticosteroids, and some of that is just that misinformation that's out in the community. And there were some research studies done many years ago, back in the 1960s when they were first started, which looked at using sort of early topical steroids on the skin of normal people. And by normal people, I mean people without eczema or other sort of skin conditions. And when they did that and used them at long periods of time, they were able to induce some side effects that people worry about with topical corticosteroids, such as thinning of the skin. But in reality that was really sort of like an overdose situation. Just like if you take Panadol inappropriately, you can cause yourself harm. So with any kind of thing, any kind of medicated cream, we know that it needs to be supervised by a doctor and coordinated. But what we did a few years ago at Royal North Shore Hospital, we looked at a large group of children, and these were children who used topical corticosteroids for long periods of time to control their eczema. And we looked to see if we saw any problems with this so-called skin thinning or other sort of side effects in those children. And we were really reassured by the fact that over a 9-month period, we didn't see any troubles. So what it tells us that in that sort of situation, when you're using topical corticosteroids to settle down the inflammation of the eczema only, and when there's no inflammation, just to go back to the regular moisturizer alone, that you don't see any trouble. And this led to a consensus statement, which means a group of paediatric dermatologists from around Australia and New Zealand who got together late last year and published an article on it this year looking at all the side effects around topical corticosteroids to basically reassure people that in this paediatric setting it's very unusual to see any real problems at all.
All right. And how can healthcare professionals best develop a framework so there is a consistent approach to patient advice on the use of topical corticosteroids?
What we know from chatting with parents who have children who suffer from eczema, they get a lot of information about topical corticosteroids from a range of different places. This includes getting it from the internet, from family and friends or random people in the street even sometimes, but also from their general practitioner and their pharmacist. And what we've found is that there is a real spectrum in knowledge or differences that can exist between pharmacists, general practitioners and dermatologists. You also have great dermatologists, general practitioners and pharmacists that speak the same language and sing from the same song sheet as they say, around the safety and the effectiveness of topical corticosteroids. But we know that when you hit someone in that group who is not up to date with the latest information, who's not up to date with the research that's been done in the last 5 to 10 years to show the safety of topical corticosteroids as well as the effectiveness, that can dramatically impact upon that parent or that patient around their feelings or their understanding around the safety and effectiveness of topical corticosteroids. And if you have confusion, what this leads to is people are less likely to use the topical steroids, which means they're less likely to get on top of their eczema and more likely to have long-term problems with their eczema. And we have to remember, importantly, that eczema affects the whole family. It's not just the child who has the eczema. If there's one person in the house that's not sleeping because they're scratching with their active eczema all night, it means no one in the house is sleeping. That means they're not performing well at school. It means the parents aren't doing well at work or looking after the rest of the children the next day because everyone's tired. So we have to remember that this is not just a skin condition. It actually has huge impacts on the family as well. So it's important that we all sing from the same song sheet around the safety. I'm very happy to share the information as we're doing around the evidence and the evidence basis for these.
So there's been some varied advice on the application of topical corticosteroids. So what are your thoughts on that?
One of the main reasons people are afraid of using topical corticosteroids is they're afraid of this thing called skin thinning. And part of the problem is that they used to get the prescription from the GP or the pharmacist and they'll be told just to use it sparingly. And then they'd get the prescription which has on the box written sparingly as well. What this does is create confusion because nobody actually knows what sparingly means. It's a statement, it's a word, it means kind of use thinly. But what is one person's thinly compared to another person's thinly? By creating this confusion, it means that parents and patients don't use the steroid creams the way that they've been instructed or they should to help control their disease, noting that these are just anti-inflammatories to settle down the inflammation part of their eczema. So when you have that kind of confusion, it's very important to go out and look for the evidence. And so my research team and I at Royal North Shore Hospital went to do that, in fact, and looked at the evidence around whether or not you see skin thinning from topical corticosteroids. And the long and short is you don't see that when it's applied appropriately under supervision with your doctor. We'll freely admit that I have seen patients in adults mainly, not in children, where if they've used the topical corticosteroids without supervision, on normal skin, that is to say just skin that isn't inflamed and needing the anti-inflammatory to settle down, then those patients can get themselves in trouble. But they're few and far between. And really, they're just an overdose or an abuse, in actual fact, of the medication. And they're not following the instructions that they should. So please be reassured that when you use the topical corticosteroids appropriately under supervision and using them, what we call this fingertip unit, which is a measure about squeezing a length of the topical corticosteroid out of the tube that it's in onto a fingertip and using that to cover the area of about a full hand space on a body, that means you will have no troubles. But what you will do is treat your disease effectively.
And what would you say is the biggest misconception about eczema?
The biggest misconceptions that I've discovered through the research that I've done talking with parents is that they worry about thinning of the skin, but they're also worried that it's going to do some, detrimental effect to the child. It's going to stunt their growth. It's going to affect their immune system, all those sort of things. And what they're doing there is mixing up the potential effects from oral steroids, where you're taking a tablet, which is a systemic, meaning the whole body is affected by that tablet, versus a topical cream or an ointment, which is applied directly to the affected area of the eczema and treats effectively that area only. When you use the creams and ointments, very little, if any, of the topical corticosteroid is actually absorbed systemically, meaning further into the body. So you're not going to see those effects that you can see with oral steroids. And that's why dermatologists in particular shy away from using oral steroids where possible for skin conditions, because we're able to use more effectively the topical variety with much better safety profile and effectiveness.
So I know of a new storybook that you've just released, I believe, called Elliot's Meditotz Adventure, which was written by a team of eczema experts, including yourself. Could you tell us more about it?
So I, like many people in Australia, have a child who has eczema. As I said, 20 to 40% of children in Australia do get eczema, and my son was just one of those. And I know the frustration that a parent has trying to put the moisturisers and the topical steroids on their skin to manage the disease from time to time. And it's a frustrating battle that you have on a day-to-day basis. And one of the hard things is trying to get your young child to understand why you're doing this. And so I had the opportunity to work with some medical doctor writers, and we've created this book called Meditotz, Elliot's Meditotz Adventure, which is basically explaining in children's terms with pictures and a good little story about what is happening with their skin when they have eczema and why these creams, the moisturisers and the topical corticosteroids are so important to manage their skin so they can go out and have the fun adventures that they want to in their lives as little children. So this was a wonderful opportunity that I was afforded, and I was very grateful for that. And I was able to use that to help, basically educate my son as well as other children about their skin condition. And the book is named after my little boy Elliot, and that's because it makes sense. It's something that I was very passionate about, and I understand all too well the frustrations that parents have in this situation because I live it on a day-to-day basis like they do.
Sounds like a really wonderful book. Now, how can everyone get their hands on a copy of the book?
So at present, you can get it via the Eczema Association website, and they're making it available free at this point in time, which is wonderful. And so basically get it, share it, and it's just a good way to help everybody understand and work from the same page about their child's skin condition. And once children understand that the moisturiser helps and the topical steroids help the itchiness as well, they start to get to that they understand that this is something that needs to happen. But having a good little storybook, which is great little pictures, and just helps them and speaks to them at their language. And it's not their parents telling them what to do, because let's face it, all children rile against that from time to time. But it's speaking to them in their language and in a way that they understand it with pictures and a nice little story will just help so much to get across that line. And so it was wonderful to be a part of the team to put this together, and I hope that others find it useful like I have with my son. When I first read it to him, he really lit up and started to understand why we had to do this for him on a daily basis.
All right, now, what's a message you would like to leave our audience as being part of Health Professional Radio today?
Well, obviously what we know is that eczema is a very common condition affecting 20 to 40% of children in Australia. But most kids, most of the time, will grow out of their eczema. And whilst that's happening, it is about managing it. People often try and find some type of cure or allergy or some basis that if I just change one thing, their life is going to be very different because it'll all go away. But what we know with eczema is much more complicated than that. But what we also know, it can be very well managed. And it's managed by looking after the skin to make it the best that it can be with regular moisturiser, soap-free wash, and using bath oils in the bath or short lukewarm showers if they're showering. And then when the skin flares up from time to time with those red, itchy patches, we'll use topical steroid creams, which are anti-inflammatories, to settle down that inflammation process. And then you dial in and out of those topical corticosteroids when you need to. And what we know by doing this in very simple ways, we're able to manage the vast majority of children. But sometimes some children also need other help. There are tablets and other options available to us too. So if you're worried, please see your doctor and look out for a good dermatologist to help you through all of this.
All right. Well, thank you for answering our questions today. It's been a pleasure talking to you today.
Well, thank you for the opportunity to talk about a subject that affects me as well as many other parents, and I see day to day as a dermatologist as well.
Oh, thank you. Now, you've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in studio with Dr. Saxon Smith, and he was telling us about eczema and a new storybook aimed to educate parents and kids about eczema. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.